In this tutorial, we will be discussing abdominal anatomy. We're going to approach this a little differently. We're going to use computed tomography cross-sectional images and learn the anatomy and then relate that to the sonographic images or ultrasound images. In both of these cases, we are going to evaluate the vascular relationships within the abdomen. Upon completion of this tutorial, you will be able to recognize and label abdominal vasculature on illustrated diagrams and static ultrasound images. You will need to correctly identify at least 90% of the structures within ultrasound images before progressing to the next section of instruction. Both of these books are excellent resources for any type of vascular ultrasound, and I just wanted to note them because I use them as resources for this tutorial. Also want to note that ultrasound images and CT images were courtesy of Clemson University's CBT program and the Greenville Health System in Greenville, South Carolina. We're going to compare the major relationships with the abdominal vasculature within the abdomen. We're going to look at the arterial and venous relationships, and we're going to mainly look at the main branches. We're going to begin with the aorta as it courses through the hiatus of the diaphragm. And the first branches you'll note here are the phrenic arteries. We don't usually see the phrenic arteries on ultrasound, but they are important because they provide flow to the diaphragm. First major branch that we do usually see is the celiac axis, and you note that it's got the European spelling here, but we spell it C-E-L-I-A-C, axis, and it could be celiac axis, celiac trunk, or you can even see it termed celiac artery. The celiac axis gives way pretty quickly to three major branches. We'll discuss those a little bit later in the tutorial. About a centimeter inferior to the origin of the celiac axis, you get the superior mesenteric artery, the SMA. SMA will come off anteriorly from the aorta, and then it will course anterior to the aorta, running somewhat parallel as it moves inferiorly in the abdomen. Almost immediately inferior to the SMA are the origins of the right and left renal arteries. Those will be coming off laterally from the aorta, and as you note here, they both will be posterior to their accompanying renal veins. But also want you to note that the left renal artery is going to be shorter than the right renal artery. The right renal artery is going to course posterior to the inferior vena cava and on its path to the right kidney. So it will not only be posterior to the right renal vein, but the right renal artery also courses posterior to the inferior vena cava. Very important relationship. And also note that the left renal vein, not only is it anterior to the left renal artery, it's also anterior to the aorta itself. So it is anterior to the aorta and posterior to the superior mesenteric artery. Once again, it's a very important relationship. As you move inferiorly, you have the gonadal vessels, and we typically do not see those with the use of ultrasound. But if you move further inferiorly, you will see the inferior mesenteric artery, which we do see on ultrasound. Here it appears to come off pretty much anterior. And if you look at it on ultrasound in transverse view and look at the aorta as if it were the face of a clock, the inferior mesenteric usually originates about 1 to 2 o'clock from the aorta. So it does originate laterally and somewhat to the left. We're going to course down the aorta inferiorly to the iliac bifurcation. The aorta bifurcates into the right and left common iliac arteries about the level of the umbilicus. These vessels will then course toward the lower extremities and through the pelvis. They will bifurcate into the internal and external iliac arteries. The external will continue on and go inferior to the inguinal ligament and course into the lower extremity. Now we're going to follow the venous system as it comes back up out of the extremities up to the abdomen. So the venous system, you have the internal and external veins that will accompany the arteries, as well as those two will join or confluence and become the common iliac veins. And once again, it courses with the common iliac artery. The two common iliac veins will confluence to form the inferior vena cava. Inferior vena cava will then continue and be the main conduit that leads the deoxygenated blood through the abdomen up to the right atrium of the heart. So as we move superiorly through the inferior vena cava, you see that it does have, most of the vessels will have accompanying veins, will have accompanying arteries with them. As we move up, I want you to note, once again, the relationship of the renal vessels. Both renal veins are anterior to their arteries, and the left renal vein courses anterior to the aorta itself. If you follow the inferior vena cava further superiorly on the body, you have the hepatic veins that will be draining, predominantly will be draining from the liver, and that flow will be emptying back into the inferior vena cava right before it goes through the diaphragm and courses up to the right atrium of the heart. As we move throughout this tutorial, we're going to be comparing CT images with ultrasound images. So we're going to begin in the proximal abdomen just below the diaphragm, and cross-sectional views through the abdomen. In CT, that's considered axial view. This is a CT image here, and this is the ultrasound image here. With the CT, you need to know that you're viewing this, this is the anterior aspect of the patient's abdomen, the front of their body, posterior aspect or back of the body, and we have, we're looking at this from the feet toward the head, so this is the right side of the body and left. So things like bone will show up very bright and white on the CT images, and things like gas or air will show up black. So this is the vertebral body and the posterior aspect of the patient, and we can see portions of the patient's ribs on each side here. Just in front of the vertebral body, you have a transverse view of the aorta. Now, this patient has been given IV contrast so that the blood vessels will show up brighter, and so you can see them better. So this is the aorta at the level of the celiac axis. Celiac axis will supply blood to the liver, the gallbladder, the stomach, the intestines, and the pancreas. And it has three major branches, which we've already mentioned, but I'll show them to you now. This branch is the splenic artery, and it's going over to the spleen, which is this organ here. Organs within the abdomen on CT tend to show up in varying shades of gray. Go back to the celiac axis, and this branch is the common hepatic artery, which is traveling toward the liver. This is the liver. The celiac axis also will branch into the left gastric artery. We don't see that in this particular view. We're going to move to the ultrasound image. So deep in the image here is the vertebral body. You get the shadow behind it. This is the aorta in transverse view, celiac axis, splenic artery, and common hepatic artery. This is a portion of the liver, and it's darker than usual. Usually it's a much lighter shade of gray. Also want to point this out. This is one of the things we have to fight in the abdomen. This is bowel gas. So when ultrasound hits air, it just scatters and makes it this foggy type image that's very difficult to see behind. So that's something the sonographer has to be aware of when they're dealing with the abdominal imaging, and we have to work around this, and we'll be talking about that in other tutorials within this learning module. These images are still in the proximal abdomen, and it's about 1 centimeter inferior to the point that we were when we were looking at the celiac axis. So this is CT and ultrasound. Once again, this posterior aspect of the CT, anterior aspect, right and left. Vertebral body. This is the aorta, and the really bright areas that you see within the origin here of this is the superior mesenteric artery, the SMA. The really bright areas that you see are calcific plaque that's built up within this artery. So this is the superior mesenteric artery, and just anterior, which is this way, just anterior to the SMA, we can see the splenic vein. This is the spleen, this is the splenic vein draining the deoxygenated blood from the spleen. It's going anterior to the superior mesenteric artery, and this is the portion of the pancreas. So the splenic vein is posterior to the pancreas and anterior to the superior mesenteric artery. Splenic vein will course across the abdomen and drain as it meets the superior mesenteric vein. They become the portal vein at that confluence of those two veins. Okay, I want to point out the right kidney, portion of the left kidney, portion of the liver, and we have bowel, some bowel gas. I'm going to move to the ultrasound image. Okay, patient's right, left, anterior aspect, posterior aspect. This portion of the liver here. And we'll go back. We got vertebral body with the shadow behind it. Have aorta and transverse view. Anterior to the aorta, got the superior mesenteric artery. And I want to mention that the superior mesenteric artery, it supplies blood to the intestines and the pancreas, and it courses anterior to the aorta, posterior to the splenic vein, which is what we see here. This is the splenic vein coursing posterior to the pancreas, which is this area. It's pancreas. So we got splenic vein as it's becoming the portal vein when it combines with the superior mesenteric vein. Here we have the inferior vena cava. So the aorta is the main blood vessel that carries the oxygenated blood to the organs, and the IVC, or the inferior vena cava, carries the deoxygenated blood back to the heart. So this is a transverse view at the level of the renal vessels. It's a diagram just to kind of simplify some of the relationships with the anatomy there. We've got the vertebral body here posteriorly, and they've drawn the left kidney. So left side of the body, we're going to start here. Left kidney, the deoxygenated blood is going to be flowing back through the left renal vein. It courses anterior to the aorta and posterior to the SMA, or superior mesenteric artery. It will then course between those two vessels, and it drains into the IVC, or the inferior vena cava. Same thing is going on the right side. You would have the right kidney here, and then that deoxygenated blood would go through the right renal vein to the IVC. Now, here we have the aorta in transverse. It is posterior to the SMA and the left renal vein, and it is anterior to the vertebral body. So we've got the aorta, and we see the left renal artery as it courses to the left kidney, and it is approximately, typically it's usually 4 or 5 o'clock if you're looking at this as the face of a clock, and typically if you're looking at this transverse view, the origin of the right renal artery will be around 11 o'clock, 10 to 11 o'clock. And that's if the patient is in supine position on the table. We'll talk a little bit more about positioning for these views in a different tutorial. So this is transverse view, or cross-sectional view. we're looking at the level of the left renal vein. And so we're going to start with a CT again. Now, remember on the prior slide I told you that the SMA, once it originates from the aorta, that it will then travel anterior to the aorta as it moves down the abdomen. Well, that means if the aorta is in transverse view or circular on the image, then the SMA is going to be circular on the image too. It will be anterior to the aorta, and if you see this vessel here, this is the left renal vein. This is the left kidney and the left renal vein. And the left renal vein does something very important here. It courses posterior to the SMA and anterior to the aorta. So it courses between these two blood vessels, and then it will drain the deoxygenated blood into the inferior vena cava on its way back to the heart. Here we have the liver. We have bowel with bowel gas. I'm going to look at the ultrasound image. We have liver here. This is liver, all this. This is the vertebral body with the shadow behind it. And here's the left renal vein coming from the kidney. You can't really see the kidney here, but it's coming from the kidney on the left side. It's moving posterior to the SMA, and it's anterior to the aorta. It goes between those two blood vessels, and then it's going to move over here and it's going to drain into the inferior vena cava, which is somewhat compressed. It's this little black line. It's somewhat compressed in this particular image, but that's what's happening. This is draining flow back to this vessel. Now remember, SMA is posterior to the splenic vein. There's splenic vein. Splenic vein will join with the superior mesenteric vein, which we don't see, but when it joins, it forms and makes the portal vein. Then the portal vein will eventually travel to the liver. Almost immediately inferior to the SMA are the origins of the renal arteries. You have right renal artery and left renal artery. And we have the CT image here. Once again, this vertebral body, just anterior to the vertebral body, you've got the aorta in transverse view. And this is the right renal artery origin, and this is the left renal artery origin. Now, sometimes the right renal artery will be a little bit lower in the abdomen or inferior in the abdomen than the left, just because the liver can push it downward just from sheer size of the liver. The liver is larger than the spleen, and so there's not as much effect on the left side as there is on the right. So in this view on the CT, once again, aorta, right renal artery coursing here to the kidney, and left renal artery. We don't see the complete portion of it, but just the origin in this particular view on this particular patient. Here is left kidney, portion of the spleen. Got a lot of bowel going on here, got some bowel gas. And one more thing I want to point out, anterior here to the aorta is a portion of the left renal vein that we just learned about in the prior slide. So left renal vein coursing anterior to the aorta. It's going over and it's draining into the inferior vena cava, the IVC. And then you also have this area right here, which is the right renal vein that's draining blood flow back to the IVC. So here is the right renal vein coming from the right kidney, draining the deoxygenated blood back into the IVC. And then this is the left renal vein coursing anterior to the aorta and draining into the IVC. Now, one thing you need to notice is the relationship here between these vessels. You have the right renal artery, which courses posterior to the IVC and posterior to the right renal vein. On this side, the left renal vein is going to be anterior to the left renal artery and also anterior to the aorta. And because of the location in the abdomen, the right renal artery is going to be longer than the left renal artery. It's got farther to go. It's got to go behind this IVC and go all the way over, since the aorta sits to the left of midline. Congratulations, you've just completed the abdominal anatomy tutorial. Now press the instructional button to review the anatomical relationships at your own pace. Once you feel very comfortable with this information, then press the image assessment button, which will take you to a quiz to help you evaluate all your newfound knowledge.